Welcome to Healthbeat. I'm Mia Malan. We're focusing on e-cigarettes and proposed new tobacco legislation. The Tobacco Products and Electronic Delivery Systems Control Bill has been gathering dust for years. This while the World Health Organization says urgent action is needed to control e-cigarettes, especially to protect underage users. Will 2024 be the year South Africa's updated legislation is finally passed? Local cigarette advertising has been banned in South Africa for more than 20 years. One of the last ways to promote cigarettes is on the packs themselves. The bill proposes plain packages with health warnings. Supermarkets and kiosks will also no longer be able to display tobacco products at, for instance, stalls. These rules will also apply to electronic cigarettes, or vapes as we know them, which some say are less harmful than traditional cigarettes. But many credible researchers are skeptical about claims that vapes can help people quit cigarettes. So what exactly are e-cigarettes and how did they evolve? Moali Malloy explains the vaping phenomenon.
E-cigarettes, also known as vapes, have become more and more popular, particularly among young people who seem to believe they are harmless. Pulmonologist Erica Shaddock says e-cigarettes simulate smoking by creating a fine mist of vapor, which is inhaled, hence the name vape. Vapes are usually battery-powered.
The more modern ones have sensors, so when the individual inhales on the e-cigarette, that the sensor picks up that flow and then it triggers the battery, which then heats the coil, which in a couple of seconds can heat that coil up to 200 plus degrees Celsius.
The smoke comes from heating up so-called vape juice, which has 4 main ingredients: propylene glycol or PG, vegetable glycerin or VG, nicotine, and flavorings.
The vegetable glycerine or the VG allows for a much smoother experience, it's described as, and that's what makes all of that vapor that you see. That gives, that massive smoke cloud. A lot of smokers found that e-cigarettes were too smooth, and the propylene glycol allowed for that hit at the back of the throat that most smokers were craving, and that you would get with a normal cigarette.
At first, e-cigarettes were marketed as a solution to help heavy smokers quit harmful tobacco. But we don't know if vapes are harmless.
It's not a clean liquid component. There are particles, some heavy metaparticles that come from the coil. There are obviously particles that are coming from the juice. It's not just clean steam.
Joining me online from Cape Town to discuss how e-cigarettes have gained popularity among our teens is University of Cape Town pulmonologist Professor Richard van Zyl-Smith. Richard, thanks very much for making the time to join us today. You've done a small study in South Africa among teens that have shown that many teenagers take up vaping because of stress. Tell us more about that.
So our pilot study, we used high-income schools just as a convenience sample and asked the question, obviously, how many are vaping and why do you continue to vape? And amongst those answers of why do you continue to vape, the anxiety, stress, coping came out very strongly. Now, it's obviously not the only reason. For others, there's clear nicotine addiction.
Supporters of vape often quote a statistic that e-cigarettes are around 95% less harmful than tobacco. And this comes from the UK government's review of evidence of e-cigarettes. Do you know how they came to this conclusion?
The 95% safer paper is a paper that was put together, published in a reasonably obscure journal, and put together by a group of individuals that don't have the cleanest record, as it were, from a scientific point of view in relation to their affiliations with tobacco industries and harm reduction industries. So There are a couple of red flags in terms of how it was done and who was involved. There's only one paper, and it's only that paper. And so many of us in the space say, well, 95% we think is not the correct number. Just given the number of chemicals and the dangers of tobacco, it is likely to be safer. But 95% is a very, very, very tenuous estimation. And that also only applies to people who are smoking and have a 50% chance of dying from a smoking-related illness.
Why would a government take that information and base the entire policy on that, as the UK government has done?
The UK really are an outlier in the space. Most other countries are very anti-vaping. Most other countries consider smoking cessation to be fresh air, whereas the UK consider it to be vaping. But you may have seen recently that the UK has announced they're going to try and ban disposable vaping devices because they're seeing this alarming rise in vaping amongst adolescents. So there clearly is something afoot in the UK where saying it's safe has caused problems.
In your experience, and also research-based, is there any data that's available to show us that smokers who want to quit smoking do turn to vapes?
There is a Cochrane review that looks at all the evidence and makes recommendations, and it very disappointingly is not a very good option. Now, it doesn't mean it doesn't work for the individual. But if you said to me, what's the best way to stop smoking? Vaping wouldn't be on the top of my list.
What would be topping the list to try and stop smoking? What works the best?
So behavioral modification is the buzzword. To understand why you smoke, what's triggering, and how do you change your behavior? Are you stressed? Are you anxious? Do you smoke? Are you bored? Are you angry? Whatever it is that triggers you. And that behavioral modification to try and break the habit, in addition to pharmacotherapy, so either a patch or one of the oral medications to help with the nicotine withdrawal, those two in combination is the best option.
So say you do try vaping to quit smoking. Is it a safe option to try? Are there any harms involved?
So it would be considered a safe option to use, but we would always advocate it as a stepping stone, not only from a safety point of view, but of a risk point of view, because you're still exposing yourself to chemicals, as well as remaining addicted to nicotine, as well as spending the money. So the best option is fresh air, which at this point is still free.
Now, if we just look at the nicotine that's in both tobacco and in vaping products, are there harmful effects of nicotine? Is that bad for you, or is there argument to be made it's okay to have a little bit of nicotine?
So nicotine in and of itself is not what the term we use, biologically inert. It is not a harmless substance. It's a poison that you can use to kill insects. Taken in large doses, causes a significant problem and can kill you if you drink a bottle of vape juice, for example. And the way nicotine works in the body, not only from an addiction point of view, it has impacts on the immune system, it has impacts on the endothelial system, that's your blood pressure and lining of your arteries, and it can also impact on growth of blood vessels. There's a little bit of an argument and discussion around whether it is a cancer-causing drug itself. Most people would agree that it doesn't cause cancer, but it may promote the growth of cancers because it promotes the growth of blood vessels.
Nicotine is a Schedule 3 substance, so it gets regulated. When we look at vapes, do the ingredients in vapes, including the nicotine, get regulated when it's included in a vape? How does that work?
So the problem with vaping is there's no regulation. It doesn't fit into any standard regulation. It's not a food substance. It's not a health product. It's nothing. So the government has not had the ability to regulate it. And the regulation currently before Parliament has been 7 years in the making, which will finally regulate vaping. And the proposed bill will regulate vaping exactly like it does tobacco.
Finally, what do you think of organizations like Vaping Saved My Life? They argue that you should make vapes more available, cheaper, so that you could save more people from smoking essentially, or get them to quit smoking. What do you think of that philosophy?
I have many issues with Vaping Saved My Life because you don't know that it has saved your life. That is only in the future.
Thanks very much to Professor Richard van Zyl-Smith for sharing his insights on vaping with us. After the break, we speak to someone who believes vaping has saved his life. Welcome back to Health Beat. I'm Mia Malan. Tobacco is the single largest preventable cause of death in the world. The theme of this year's World No Tobacco Day on May 31st is protecting children from tobacco industry interference. Countries around the world are moving towards stricter regulation of e-cigarettes, particularly when it comes to minors. Mohali Malloy and Yolanda Mdzeke met an anti-smoking activist working with young people in Katlehong.
Sbarisaka was smoking cigarette. I would see him, and then obviously I see lady stompy on the floor or go ashtray. I will also take Stompinyana. It looked cool. Fortunately for me, my first pull cigarette after I was like, Sananghami Joe, some inside the flames. Like, but this the same time, I lied on the floor for about a minute to two. Hakitsua, I was like, uneasy.
Katlehong community activist Twewu Musedi used to think smoking was cool. Now he spends his days teaching young people not to copy adults or to get sucked in by their peers.
And that's how it starts, and then on and on and on. And because it's nicotine which is addictive, then young people just like that.
His way of helping out is to get young people off the streets where they pick up bad habits and into this local community garden where they can be more productive.
We do have like spinach, carrots, cabbage, and they are working so hard.
But even so, devices like e-cigarettes are becoming popular among the East Rand youth. Musedi says parents don't understand the health risks of vaping, especially because vaping campaigns mostly target youngsters, and e-cigarettes are seen as a luxury item.
Here's the problem about vapes. Like they are mostly bought by people who are working, who can afford them. They buy them for all family members. Christmas, the gifts are the vapes. The kids mabai town, they are going to cry to their mama to sing land. And because now my parents know they want to please their kids and they are less informed about the harmful effects of these devices, they actually buy them.
As the Gauteng coordinator of the South African Tobacco-Free Youth Forum, Musedi has also been vocal about the country's proposed new tobacco bill. He's even attended public hearings. If passed, the bill will enforce the same rules for e-cigarettes and traditional ones. Musedi says some who go to these hearings have a clear pro-tobacco agenda, as if they've been coached.
The things they are saying are lies. Some of them are even reading from scripts or from their phones, and they cannot even read what they have written on. We are not saying tobacco should be banned or produced. Let's just get rid of the cigarettes, we put them away from our children. But exposure to them and advertising and promotion, putting these products next to our kids, they will see them and they will want to taste. Hence they make them so colorful because they know who they're going to attract.
Young people, Musedi believes, can't be protected from tobacco and nicotine if smoking isn't banned in and outdoors.
So public places, the parks, those are our spaces. Even our health facilities, we have clinics that have kuma background, kuna space, kuchwa abo nurse na abo doctor bayopem. Nonsense. We know the dangers of nicotine, we know what it does. And we also understand that Smoking is a pathway or a gateway into young people using drugs and getting addicted. We know they end up being criminals or they die from overdosing substances.
Musedi believes that despite obvious industry tactics to undermine the bill, it's up to communities to protect young people.
It's one of the only ways we can win the fight against substance and drug abuse, by being involved, everyone from government, not only complaining, pointing fingers, rejecting people. That's the role of the community. Unfortunately, the industry doesn't care. Us who can care, let's play our role.
The Portfolio Committee on Health is going around the country to get views on the new proposed tobacco legislation. Here's what could change if the bill becomes law. With me in studio to discuss how these laws could affect e-cigarette smokers is the founder of Vaping Saved My Life, Kurt Yo. Now, you have often told a story that vaping saved your life. How did it do that?
My father passed away the day before our wedding, and that was almost 22 years ago. I've lost my mother to smoking. I have lost many of my family members, my grandfathers, from smoking, and many of my family friends from smoking. My wife, a pediatrician, had always warned me when I was a smoker that I wouldn't reach the age of 50. I have 1 more year left. I've literally got 9 months left to see if I actually reach the age of 50. In terms of my health itself, I feel far better than I ever did as a smoker. Vaping Saved My Life is a movement by vapers who were former smokers.
Is Vaping Saved My Life funded indirectly or directly by the tobacco industry?
It is funded by, in part, the vaping industry, and but a very, very small part. Most of our work was done as volunteers or as a volunteer, but yes, we do receive funding in part from the vaping industry.
Now, this brings me to the new proposed tobacco laws. You have problems with them. What are those?
Number one, it doesn't distinguish the difference between the most deadliest consumable product and a product that is significantly less harmful. Number two, it puts no consideration on the person who smokes. If we look at, for example, a lot of people say that the bill says indoor smoking. There is nowhere in the bill that it refers to indoor. The bill refers to something called enclosed. So critically thinking, a person who smokes cannot stand near a wall or under any kind of roof if they want to smoke. How does that fit in the Bill of Rights? How does that afford that person basic protection?
We've got very, very clear evidence that shows that smokers don't only harm themselves, they harm people around them. That secondary smoke that you inhale can be as dangerous to you as the person who smokes. So surely there should be restrictions on what those people do.
Absolutely. And the existing bill caters for that. It creates a dedicated area for smokers to participate in the practice that they are doing. 100% agree. I am no way saying that it should revoke and anybody can smoke anywhere else. But what I'm saying now is that this bill doesn't even afford them, whether it be away from everybody else, the protection of purely a basic roof over their head in a public space.
But wouldn't you say that what they do is bad? It's a bad thing to smoke for your health. So if you make smoking hard to do, wouldn't the argument be that you discourage people from smoking?
What about offering them the services and the solutions to help them quit, rather than hitting them with a stick?
Kurt Yo from Vaping Saved My Life, thanks very much for sharing your views.
Thank you very much, Mia.
After the break, we speak to Public Health Policy Consultant, Zanele Mthembu. You're watching Healthbeat where we are examining vaping and proposed new tobacco legislation. With me is Public Health Policy Consultant Zanele Mthembu from the Campaign for Tobacco-Free Kids. Zanele, thanks very much for making the time today. You were formerly the Head of Health Promotion in the National Health Department. What insights can you share with us as to why it's taking so long for this tobacco bill to get passed?
Only last September did the parliamentary process kicked in. Now you ask the question, what took so long? Remember, new things have come on board. We've got now emerging nicotine products, and government had to take time to do the groundwork, to look at research, and also to understand what these new products are. Remember, electronic cigarettes also have harm. It doesn't matter the level of harm. They are harmful, and therefore they will be regulated the same way as conventional cigarettes.
So just to get a little bit practical here, if you go into a vape shop at the moment, there would be different flavors with special names, bubblegum flavor, and very attractive names for young people. Would we now, if this becomes law, this bill, no one would be able to advertise the flavors, for instance?
Let's look at the intentions. Why is the industry, the electronic cigarette companies, adding those flavors? They are adding those flavors precisely to attract young people. The evidence, qualitative studies that have been conducted, they are revealing that young people are saying they are buying these products because they're healthy. And when you ask them, why do you think e-cigarettes are healthy? Oh, because they've got flavors, fruity flavors, bubblegum, strawberry, watermelon, all the fruits are healthy. So you can see the deceit and misleading, the deceitfulness by the industry. We will ensure that those descriptors, the flavors, are also banned. Whatever applies to tobacco products will also apply to your electronic cigarettes and your heated tobacco.
When do you think Parliament would approve this bill?
The time frame is difficult to tell because the first level of public participation process is still underway. We are made to believe that it will conclude somewhere around March. And then after March, April, May, we have national general elections. And there, after the elections, that's the time where we anticipate that the parliamentary public hearings will commence.
Zanele Mthembu, thanks very much for joining us, and thanks for your efforts to protect children against tobacco industry interference. That's our smoking show. We hope it's brought some clarity about the proposed new laws and that you feel encouraged to inhale only air into your lungs.